Hello everyone, this is Bob Browner with Community Coronavirus Update number 23. Today we're going to talk about some better ways of using our data and how hopefully data can help us guide our daily actions, and a few challenges for the schools that we're going to have to start working through this summer. So the new reported cases in Nebraska looks like they may be going back up again a little bit. We kind of hit our peak in early May. We'll see what happens as we start opening things up a little bit. This comes from the New York Times website. Um, a month ago, someone asked me, well, what happened to that bet you made? Nobody took me up on the bet. And a month ago, I said I thought we'd have 50 to 180 deaths, probably for Grand Island, not Nebraska, and that would probably be the case by this summer. And so Nebraska, that initial projection was way off. As of today, we're almost above that for Nebraska, and it looks like Grand Island, unfortunately, is about 42. So by the summer, it probably looks like that's where we're headed. The good news, although we'll probably unfortunately have, I think, probably 400 to 600 deaths by the end of June. That could have been thousands of deaths, and so I think we did do the right things by closing the schools, and we did. The social distancing has made a big difference. We had a lot of hot spots that were in meat processing facility communities, and you can see that's what essentially all these little red lines here. And this was JBS in Grand Island. This was Tyson in Lexington. This is in Saline County. You had Smithfield. Luckily, we're past a lot of those, it looks like. So, but we are getting some more cases in Douglas County and Sarpy and maybe some Dodge County. So things will change a little bit based on where you live in Nebraska. So we do have some data problems, and this is something I hope we can get fixed here in the next few weeks, because to have a good response to coronavirus, we need better data. We need to use it correctly. One of the key things to do is if you're going to stop an epidemic. This TED talk I talked about a few months back from Larry Brilliant, that early identification and early response means you have to have rapid test turnaround. And one of our biggest problems right now is just this, although we're getting enough tests, the time it takes to get the result is too long. An example here in Lancaster County is a week and a half ago. On this Monday, we had over 90 cases, but most of those cases weren't that day. They were actually drawn this week, but the turnaround time in our labs got to 3 to 5 days. And then, of course, you had a weekend, so this was a Sunday. So although these tests were resulted here, they were actually drawn way back here. And so it's causing our data to fluctuate quite a bit because of turnaround time on our tests. And last week we were back to about 48-hour turnaround. Now I'm hearing from physicians it's as long as 5 days to get results back again. So this is going to limit our ability to do contact tracing, because it takes you 5 days to get a test back, by the time the contact tracer calls, you have to remember what you did a whole week ago. And so to do good contact tracing, you really need results within 24 hours. And so this is one of my things I think we need to get fixed the fastest. The good news is that across the state, we have kind of different results. The places where, like I said on the New York Times article, we ran some numbers. Lexington, it looks like they've gotten past their surge and dropping almost to a few cases of the last week. Same in Grand Island. Platte County and Saline County, they're hopefully on the continued downward trend. Douglas County and Sarpy County, unfortunately, have an upward trend. Keep in mind, these are not necessarily comparable, because these aren't population adjusted on the same scale, so you can't compare this graph to this graph, because they're not the same scale. But again, seeing these upward trends is concerning in some of these areas. And although it's nice to see that in Grand Island, Lexington, that had our first outbreaks, they are really seeing a nice downward trend. Timing and predicting of hospitalizations, as I've said before, using your hospitalization rate as your guide is not a good measure, because that trails your infection rate by 2 to 4 weeks. Ideally, you would look at your infections as they come in. Of course, that requires that they be timely. But then what you want to do is start looking at the demographics of the people that are getting infected. If you had that good data, you could actually project what your hospitalization rates are going to be in 2 to 3 weeks. And that would give you a nice leading indicator of a hospital capacity. So this comes from the Lancaster County website, and they do have some demographic breakdowns, actually. So if you look in Lancaster County, most of our positives are in the 20 to 60 range, which is a generally lower risk population. So because of that, although our numbers are fairly high, it's probably a relatively healthy population. You can see by the ethnicity that it's overrepresented by Asian and Hispanic, and these are probably Smithfield workers, basically. So, but the good news is they're young and healthy. The question, though, is when they came home and infected their family members, are they going to be somewhat older family members, say their parents or grandparents, for example? Will it leak into a nursing home? This is where our concerns will really want to watch the demographics, because if this starts going up, then our hospitalization and ICU capacity is needs are going to grow up quite dramatically. So if these are all young people here, you wouldn't expect many hospitalization, but if you're starting to get an older demographic here, that would affect your hospitalization rate. And so this is something, if we had a better database for the state, we could really project our hospitalization rate, needs, ICU capacity, everything based on these numbers. Another thing that might help us is antibody testing. Antibody testing is not useful at the individual level, so don't go running out and get your antibody test anytime soon. But we might use it for a population sample. So for example, Spain did a sample to see how far along they are in their rate. They think about 5% of Spaniards are infected, which the unfortunate thing about that means they've got a long way before they get to herd immunity, so there's a good chance they have a second and third wave. Even in New York, I saw a study where the different boroughs of the New York range from around 12 to 25%. So as bad as things were in New York, they're not finished yet, so they could also even have a second or third wave in New York. We could do something similar like in Hall County where Grand Island is. Maybe we should do a random sample of JBS employees. There's a chance that JBS employees are actually at herd immunity, which would be good for their plant because then they wouldn't have to worry too much about continued infection. But the general population may be much lower, in which case the general population has to be more careful. And so antibody testing would give us some useful things to look at. So let's look to masks again. We keep hitting this over and over again. This is probably the single most effective thing we could do is to get people to wear masks more. And so I want to use another way to explain it. And there's something in public health called the precautionary principle. And generally, a precautionary principle means if there's something that could kill a lot of people, you don't do it until you prove it doesn't kill a lot of people. And so that's essentially why we had to close the schools down. We in rapid succession in May or in March because we didn't know how bad the virus was going to be, and we couldn't take the risk that it would be as bad as it is. And fortunately, we did close the schools in time because it was as bad as feared, and we probably would have had thousands of deaths had we not done that. And it's kind of like hunter safety. And so when I was a kid out in western Nebraska and Sydney, the home of Cabela, so everybody pretty much hunts out there. We had hunter safety at the Lodgepole Valley Youth Camp, and our instructor at the time was Officer Conley, who a lot of us, he had a lot of credibility and people trusted it, and I still remember a lot of the lessons he taught us, so he must have been a pretty good teacher. But when you're handling a gun, basically, if you're like these hunters, you always have your gun pointed at the sky, because if it accidentally goes off, you can't kill the sky, but you might kill your buddy. And so if you look at people hunting, you'll see all of them having their gun pointed upwards. Also, when you handle a gun, you always assume it's loaded. No matter how many times you check, you always assume it's loaded. How many accidental deaths have happened where someone have accidentally shot, their wife, their buddy, their brother, because they were goofing around with a gun, thinking it was unloaded when it really was. And essentially, that's the precautionary principle. You always assume the gun is possibly loaded, and that's just a basic tenet of gun safety. So listen to Officer Conley and your hunter safety people. It's basically the same thing with a mask. Okay, I don't know for sure if my nose is loaded or my mouth. If I have coronavirus, we do know that about 20 to 30% of people with coronavirus have no symptoms. So you literally don't know if you're loaded. Also, people are contagious probably 2 to 3 days before they have any symptoms, and maybe they're most contagious the day before their first symptom. So the reason you're wearing a mask is not to protect yourself. You're wearing it to protect everybody else, essentially. So me walking into G Landscaping 2 to 3 minutes, I'm not going to get infected, but I might infect him because he's got customer after customer coming in all day, and I don't know about his health conditions. And so basically the reason you wear masks is the same reason reasons behind hunter safety. So, and again, there's more and more visuals. I think this is another good visual in addition to the Navy study I've cited before. If this person who's symptomatic is wearing a mask, it cuts down the droplets so much that everybody else is much safer. And of course, as both people are wearing masks, then very few of those droplets would get in, and it would cut transmission dramatically. And again, it's been used for over 100 years. I found, thus we talked about how mask units, they were using washable cloth masks back in the 60s and 70s. Saw this picture on the internet. This was actually football fans wearing masks at a Georgia Tech game in 1918, which is relevant because a lot of people are asking, what about football games this fall? Well, we might be able to have football games with fans, but if we do have them with fans, we'll want to be more spaced like these people are, and we'll probably want to be wearing masks. Another great example is Japan. My daughter lives there, and we talked with her over the weekend. She's in Kyoto, a city of I think about 1.5 million, almost the size of Nebraska population-wise. When I talked to her this weekend, they hadn't had a single case in 6 days. Well, why? Because the Japanese do the right thing. One is they wear masks. The other one is they have a very clear public health campaign pushed at all levels, federal, state, and local. Things like closed spaces, crowded places, close contact settings, all these are going to put you at a high-risk setting. It's put in nice graphics, even translated into English because this is the Japanese version. So this is a nice thing. They've pushed this out at all levels, and so what we need is better communication and public health campaigns coming from all levels of our government, which we just haven't had yet, unfortunately. And part of the problem is politicians versus scientists. So Fauci was initially skeptical of masks, but as the data came in, that made it pretty clear that wearing masks would work, you'll see them wearing masks. So you see the scientists wearing masks, you see the politician not wearing masks. Politicians don't like to admit they're ever wrong. And so scientists actually are okay mostly with admitting they're wrong. For us, that's a sign of intelligence, that I'm going to listen to new data and adjust accordingly, because we always want to follow the latest, best data. So everybody is pretty much in the scientific community around saying, yes, we should all be wearing masks. As far as clear communication, like I said last time, I really like the report put out by Tom Frieden here just recently. Basically, if you were going to communicate to the public, what we assume should be really easy to understand. So I like the stoplight mentality. Transparent and data driven. I think we could have a little better data, and we could be a little more transparent with our data. And you need practical things that how you can adapt to where you live, and I'll talk about a few of those things. The other thing that I'm frustrated by, we need to be a little more collaborative. Schools, physician networks, public health departments all need to start working together. That's not happened to the degree that I've hoped so far, but hopefully we'll get there in the next couple of weeks. As far as transparency, I like this covidlocal.org metric where they actually say, how do you decide whether you're in the green, orange, yellow level? Well, they actually give clear numbers so that you can figure that out, anybody can see. I think we need a little more trust and transparency given our politics. So if everybody understands how the level is set, I think people are more likely to follow it. It's also going to be very, very local, which I think is very important. And so if you look across the state, there's places where there have been no cases. They're in the green level. They don't have to do as much, but there's others that are hot spots. But the other thing is those hot spots change over time. So you have to follow not just this map, which tells you that it varies local, but what's happening and trending in your neck of the woods. So for example, if you're in Platte County or in Dawson County, it's going to be different than if you're in Douglas or Sarpy. So if you're in an area where you have an upward trend, you're going to have to be a little more cautious. If you're in an area that had a huge outbreak like Hall County and Grand Island, but now you're dropping almost to zero, you might be red here, but now you might be ready to go yellow. And if this continues down to zero for a while, you might be up into the green level. And so this would be a good way to set that metric. Here in Lincoln, Lancaster County, we have a metric which I think is very helpful as long as we know how these bars are set. And if we trust them, then we can follow those. And hopefully, I would like to really see this actually put in the newspaper, just like the weather report. Hopefully, every county will have this so people can just look at this and decide what they need to do. Just like when I look at the weather and decide if I'm going to put a rain jacket on or how I'm going to dress today, I could look at this and say, do I need a mask today? Because we are going to have to adapt and respond. So as Tom Frieden's other stuff has said, we're probably going to have 2, 3, we may even have a fourth wave. We have to know how we're going to act during these times, just like we act when the weather changes. And so what are we going to do as individuals? Actually, I thought there was a really nice article put out on NPR last weekend. Everything from camping to dining out kind of talked about the relative risks of various activities, because you're essentially going to have to create your risk tolerance. Remember, there's no such thing as zero risk. So we have to decide what's the amount of risk I'm willing to take. And so this is something you can really adapt to you. So if you have that weather report of whether, how worried you should be right now, you can talk about what is your risk tolerance with you and your family members and say, okay, what am I willing to do? So the general concepts, just like this Aaron Bromage article from a few weeks ago, I like this guy, William Miller. It says, really, you got to think about time, space, people, and place. The longer you're there amongst people, the higher risk of infection. The smaller the space, the higher risk of infection. The more people, the higher risk of infection. The type of a place, indoor versus outdoor. So, a call center, a church, indoor restaurant, that's going to be a higher risk. An outside place like a swimming pool or going for a hike is going to be much lower risk. And so they kind of had a list of different activities. I actually like the BYOE, which is bring your own everything to a gathering like we did in our neighborhood. We bring our own cooler and our own chairs, and we hang out on the driveway, appropriately spaced from everybody. And at those points, actually, I don't wear a mask because we're spaced out and it's a safe setting. A friend using your own restroom in your house, that's probably okay too, actually, although we walk home to use the bathroom just to be careful. A beach or a pool, so people have been asking about that. The chlorine in the pool will probably help break down the virus as well. So as long as people are spaced appropriately, and then when you're laying on your towel that you're also spaced again, you're probably okay. Keep in mind that the virus breaks down faster outside. Ultraviolet from the sun will also break it down faster. Public restrooms, as long as they're cleaned and well ventilated, should be fine. Going on a vacation to if you know someone with a cabin at the lake, that's probably a safe place to be as well. Hotels, if they're cleaned, if you're again staying out of the hotel restaurant bar, of course, but the hotel room itself is probably okay if adequate and clean. Same with camping and exercising outdoors. High risk areas though, eating inside a restaurant, church services, weddings, bars, nightclubs, a haircut without a mask. I think with mask probably okay. If you're like me, I'm starting to get coronavirus hair, so I'm thinking about getting a haircut next week, but I'll be wearing a mask when I go, and I'm not going in if they're not wearing masks either. Another question I often get is, what about physicians' offices and dentists? And I would say these are perfectly fine right now. So physicians' offices have mostly rejiggered themselves so that they are, for example, a lot of them, rather than having you come in the waiting room, they tell you to go to the park, stay out in the parking lot, and they'll call you when your appointment's ready. And that's to prevent people getting around too close in the doctor's office. And so I think it is safe to go to the doctor's office. They will want you to wear a mask, and if you don't have one, they'll likely give you one. And so they're about behind the masking as well. We need to get people back to the physician office, because one of the things I'm worried about is we're going to have a drop in vaccinations for kids, for example, because people haven't been getting in. So it's okay to go in for that well check and get that vaccine. Dentists probably also okay. You're going to have to take a mask off, but they're going to be wearing masks to protect you. So if the dentist is okay and he thinks he or she has the setup, plus the dental folks probably have a higher quality mask, probably an N95 or something like that. So I think physicians' offices and dentists are okay right now. And also, along with physicians' offices, they're actually they're getting better access to testing. So if you think you need to be testing, call your doctor's office. Some of them will do drive-up testing as well. And so if you want to get tested, call your primary care doctor. So will schools start in August? That's another thing I get pretty frequently. This is a really tough subject, and we'll probably have to have more about this in the next coming weeks. Keep in mind that 99.9+% of students will be just fine. We're not closing the schools to protect the kids for the most part. We're actually closing the schools to protect the community. So that's kind of a little different concept, and it's a different way of thinking. It's going to be really complicated. We do need to get kids back in schools, but we have a lot of things we have to work out over the summer. We do have a few kids with health problems, with diabetes, heart disease, for example. We may have to have a way for them to continue their education remotely to protect them, for example. And maybe the kids are fine, but their family members may have chronic conditions, so those kids might have to be remote as well, not to protect the kids, but to protect contact with the family members. Also, keep in mind 10% of school staff will have chronic conditions, and so maybe some of the teachers will have to teach remotely so they can stay safe. And then schools are as vector spread in the community, and so that'll be a challenge. So whether we open the schools will also happen as a protective measure for the whole community. So this will be a hard thing to figure out, and we're going to have to figure it out within about 2 months how we're going to do this. I think it's likely we're going to have various stages of opening depending on the weather report of coronavirus, basically. So again, at the end, the other thing we're working on, we have put on the mask friendly business page. So if you want to go to that link on healthylincoln.org, there's actually a survey where you can enter information, and one of our staff will call you up to clarify how you want to be listed on the website. I think that's important for our high risk people in the community. They need to know where they can safely go, and so we are populating that web page to say, okay, what businesses are places where people will be wearing masks, so I could go there safely if I have any health conditions. So hopefully this is all helpful to you. Again, healthylincoln.org is where we have all this, the past videos, the mask-friendly business, and some other resources. This is where I work on these various cases, so you know what I do for a living. These aren't necessarily opinions of the where I work, but we do think this is helpful for you to know some of this information.